Hello students, today we will be studying General Anatomy of Joints Part 2. In the previous video on joints, we had studied the definition of the joint and we did the synarthrosis, that is the fibrous joints and the cartilaginous joints in detail. In this video, we will be studying the diarthrosis or the synovial joints in detail. Diarthrosis or synovial joints have a few characteristic features. These are freely movable joints. The articular surfaces of the bones are covered with articular cartilage. This is hyaline type of articular cartilage. The joint permits free movement as it presents a cavity filled with synovial fluid. The joint cavity is enveloped or covered by articular capsule, which has two parts, an outer fibrous capsule and an inner synovial membrane. The bones are further connected or strengthened by the help of ligaments, and at times the joint cavity is divided either completely or incompletely by articular disc or meniscus respectively, and these are made up of fibrocartilage. What we see here is a diagram of a synovial joint. This is the proximal articulating bone and this is the distal articulating bone. These are the articular surfaces which are covered by hyaline articular cartilage. And the two bones are connected by the capsule, which has got two parts, the outer fibrous capsule, also called as the capsular ligament, and inner to it lies the synovial membrane. What we see here is the joint cavity. Now let us see these features a little bit in detail. Articular cartilage. This is made up of hyaline cartilage or fibrocartilage in membranous ossification. So bones which are formed by endochondral ossification show presence of hyaline articular cartilage, while those which form by membranous ossification show fibrocartilage. This cartilage is avascular, non-nervous and elastic, and if damaged, it is replaced by fibrous tissue. So what we see here is the articular cartilage. Now as we see here, this is the convex surface and this is the concave surface. The articular cartilage which covers the convex surface is thicker at the center and tapers at the periphery. Opposing to this, the cartilage which covers the concave surface is thinner at the center and is thicker near the periphery. What is the function of this articular cartilage? It provides smooth gliding surface. It reduces the forces of compression during weight bearing and muscle action. And it also regulates the growth of the epiphysis. Next we study the synovial fluid. This is a slightly alkaline, viscous and glary fluid. It is a dialysate of blood plasma along with hyaluronic acid. It contains more acid and has more viscosity. Cellular content of synovial fluid includes monocytes, lymphocytes, macrophages, synovial cells, leukocytes, and a few traces of proteins. What is the function of synovial fluid? It maintains nutrition of the articular cartilage, provides lubrication of the joint cavity to prevent wear and tear of the articular surfaces. The viscosity maintains lubrication and movement of the joint further encourages lubrication. Next we study the articular capsule. This is made up of two parts, an outer fibrous capsule and an inner synovial membrane. Fibrous capsule. It completely invests the joint. It attaches to the bones just close to the articular cartilages. It is formed by bundles of collagen fibers arranged in irregular spirals and is sensitive to the position of the joint. It is pierced by the blood vessels and nerves which go to supply the joint. This picture here shows us the outermost fibrous capsule or the capsular ligament attaches to the bones very close to the articular surfaces and the articular cartilage. Function of the fibrous capsule. The articular capsule binds the articulating bones and it supports the synovial membrane which lies just on the inner aspect of the fibrous capsule. Next, we study the synovial membrane. This is a highly vascular and cellular connective tissue membrane that lines the inner aspect of the fibrous capsule and the bones which are forming the joint. This membrane ceases at the periphery of the articular cartilage, articular disc, or the meniscus. This picture shows us the synovial membrane which lies just on the inner aspect of the fibrous capsule. It also lines the articulating bones but does not cover the articular cartilage. It will not cover the articular disc if present. It will also not cover the menisci when present. What is the function of the synovial membrane? It secretes the synovial fluid that provides nutrition to the articular cartilage. It liberates hyaluronic acid that increases the viscosity, and it removes particulate matter and worn out cartilage cells. Next, we study the ligaments. These are of two types, true ligaments and accessory ligaments. True ligaments are thickenings of collagen fibers of the capsule. They strengthen the joint from the exterior aspect. Accessory ligaments form additional bonds between the bones, and these may either be seen intracapsular or extracapsular. What we see here are ligaments. This is the knee joint. What we see here are the cruciate ligaments, anterior and posterior cruciate ligaments, which lie inside the joint cavity. So these are intracapsular ligaments. And what we see here are the lateral collateral ligament and the medial collateral ligament, which lie outer to the fibrous capsule. So these are the extracapsular ligaments. Functions of ligaments: they permit the desirable movements, they prevent undesirable movements, and they maintain stability of the joint. Articular disc or meniscus. This divides the joint cavity completely or incompletely and is attached at the periphery to the inner aspect of the fibrous capsule. It is made up of fibrocartilage with more of fibrous tissue. An articular disc divides the joint cavity completely. An example being Temporomandibular Joint, Sternoclavicular Joint, and the inferior Radioana Joint. Meniscus divides the joint cavity incompletely because the meniscus is a C-shaped structure. Example, knee joint and acromioclavicular joint. What we see here is the temporomandibular joint. This is the head of mandible and this is the mandibular fossa of the temporal bone. What we see here is the articular disc, which completely divides the joint cavity into two compartments. Similarly, what we see here is the sternoclavicular joint. This is the medial end of the clavicle and this is the articular surface of the mandibular sterni. What we see here is the complete articular disc dividing the joint cavity into two compartments. What we see here is the knee joint. What we see here are the two menisci, the lateral meniscus and the medial meniscus. These are C-shaped structures which incompletely divide the joint cavity into two compartments. What is the function of the articular disc or the meniscus? It helps in lubrication of the joint. It appears where gliding movement is associated with angular movement, and it prevents wear and tear of the articular cartilage. Now that we have seen all the characteristic features of the synovial joints, we now move on to study the classification of synovial joints. There are various ways in which the classification of synovial joints can be done. The first way is according to the number of articulating bones. Synovial joints can thus be classified into simple and compound joints. Simple joint is when only two bones enter in the articulation. Example being interphalangeal joints. What is seen here is a simple joint. Only two bones are forming the joint, and that's when we call it as a simple joint. Compound joint is when more than two bones are involved in the articulation and they share a common articular capsule. Example being the ankle joint or the radiocarpal or the wrist joint. So what we see here is elbow joint formed by three bones, humerus, radius and ulna. So it's a compound joint. And what we see here is the radiocarpal or the wrist joint, which is formed by radius and the proximal row carpal bones like the scaphoid, lunate and triquetral. So more than two bones. So this is again a compound joint. Another way of classifying synovial joints is according to the presence of the articular disc or meniscus. Complex joints. When the joint is divided into two compartments by an articular disc or a meniscus, that type of a joint is a complex joint. An example being the knee joint, sternoclavicular joint. So what we've seen already, this is knee joint, menisci dividing the joint cavity into two compartments. Thus, the knee joint is a complex joint. And also what we've already seen, the temporomandibular joint and the sternoclavicular joint. Articular disc completely dividing the joint cavity into two compartments. So these joints are complex joints. We can also classify synovial joints according to the degree of freedom of movements into first degree, second degree and third degree joints. And examples for these being ankle joint for first degree, wrist joint for second degree and shoulder joint for third degree. Another way of classifying synovial joints is according to the axis of movement. Movements occur at joints along a particular axis. So, if there is no axis along which the movement is occurring, these types of joints are non-axial joints. There are joints which have only one axis along which movements are occurring, one axis along which one set of movement occurs. They are called as uniaxial joints. If there are two axes along which two sets of movements are occurring, these are called as biaxial joints. Such joints would also have a combination of all these four movements, which is called as circumduction. And if there are three axes along which movements can occur, it's called as a multiaxial or a polyaxial joint. And even these joints will show circumduction. So let us see this in little detail. So non-axial joint, herein the movements are not occurring along any axis. These are plane type of joints, where the articular surfaces are flat and they produce only gliding movements in various directions. So these gliding movements are not occurring along any axis. So plane joint is an example of non-axial joint. And what are these plane joints which we see in the body? Examples are intercarpal joints, intertarsal joints, and joints between articular processes of vertebrae. What we see here is a plane joint. Articulating surfaces are flat. Only gliding movement occurs at these joints. Next we study uniaxial joint. Here the movements occur around one axis with 1 degree of freedom, so there will be only one set of movements occurring. Uniaxial joints are of two types: hinge variety and pivot variety. Hinge joint, where the movement occurs around the transverse axis. One surface is convex like a cylinder and the other articulating surface is reciprocally curved. These type of joints have strong collateral ligaments. Examples being interphalangeal joints, elbow joint and ankle joint. Now herein, interphalangeal joints are typical hinge variety of joints, while elbow and ankle are modified hinge type of joints. So this here is a diagram showing us the hinge joint, where one articular surface is convex cylindrical and the other is concave cylindrical, and there is a transverse axis along which the movement occurs. The next type of uniaxial joint is the pivot joint, where the movement occurs along a vertical axis. One bone acts as a pivot, which is encircled by osteoligamentous ring, and the other bone will rotate along the axis formed by the bone. So one bone forms the axis along which the other bone rotates. An example being Radioana joint and Atlantoaxial joint. So this here is superior view of the superior radioulnar joint, where we see the radius and the ulna. Here the ulna is the axis. Bones are held together by an annular ligament, which is an osteofibrous ligament. Taking the ulna as the axis, the radius will rotate along the ulna, and that is what is the pivot type of joints. Then we go on to see the biaxial joints. Here the movements occur along two axes and there is 2-degree freedom of movement, and this is also divided into two types, that is the ellipsoid joints and the bicondylar joints. Ellipsoid joint, where one articular surface is convex and elliptical in outline and the other is concave and reciprocally curved. The movements take place here are flexion extension as one set of movements and abduction adduction, which is another set of movements. So two axes and two set of movements, and it will also have a combination of the four movements, that is circumduction. No rotation occurs in ellipsoid type of joints. And examples being wrist joint, metacarpophalangeal joint and metatarsophalangeal joint. So what we see here is the elliptical articular surface, movement occurring along two axes, transverse axis and anteroposterior axis. So the articulating surfaces, one is going to be convex elliptical and the other will be concave elliptical. Next we go on to study the bicondyloid or bicondylar joint. Here the movements occur along transverse and vertical axis, and these are modified hinge type of joints. Each bone has two condyles, may have same or separate articular capsules. Example being knee joint, wherein they have the same articular capsule, two condyles of femur articulating with two condyles of tibia enclosed by a single fibrous capsule, whereas temporomandibular joint, where there is the head of mandible articulating with the mandibular fossa of temporal bone on right side and left side. So these are two separate condylar joints covered by separate capsules. So this what we see here is the bicondyloid joint, where two condyles articulating with reciprocal two condyles, movements occurring along two axes, transverse axis and vertical axis. Next we study the polyaxial joint. These joints have 3-degree freedom of movement. Movements occur along 3 independent axes, transverse, anteroposterior and vertical. Movements possible here are all the three sets of movements which we can see. Flexion extension as one set, abduction adduction as the second set, and medial rotation and lateral rotation as the third set of movements. And we will also be seeing circumduction in these type of joints. Polyaxial joints are of two types, spheroidal or ball and socket and saddle variety. So spheroidal or ball and socket joint, this has a spheroidal or ball-shaped articular surface of the distal bone which moves within the socket of the proximal bone around three independent axes having one common center. So here one articular surface is like a ball which fits into the socket of the other articulating bone. Example being shoulder joint and hip joint. So what we see here is picture of the hip joint. The ball of the distal bone articulates with the socket of the proximal bone to form ball and socket or spheroidal type of synovial joint. Second variety is saddle joint. In this joint, the opposing articular surfaces are like a saddle. A reciprocal manner, it's going to be saddle shaped, that is concavo-convex. Movements possible here are again all three sets. Flexion extension as one set, abduction adduction as the other set, and conjunct rotation as the third set. And we will also be seeing circumduction in these type of joints. Example being the first carpometacarpal joint and the sternoclavicular joint. So what we see here is a saddle joint where the articulating surfaces are reciprocally concavo-convex or reciprocally saddle-shaped. Another way of classifying synovial joints is according to the shape of the articulating bones. And that is how we classify them as plane joints, hinge, pivot, bicondylar, ellipsoid, spheroidal, and saddle. So this is how we classify the synovial joints. Now we see the factors which maintain the stability of the joints. First is the bony configuration. If the two articulating surfaces are congruent with each other, as is seen in the hip joint and the ankle joint, such joints will be very stable. But stability is inversely proportional to the freedom of movement. So if a joint is stable because of the congruent articular surfaces, the movement, the range of movement in that joint is going to be lesser. So more the stability, lesser the range of movement. We can compare the hip joint here with the shoulder joint. In hip joint, the bones are congruent enough, joint is stable, but range of movement is less. Whereas in the shoulder joint, the bones are not that congruent enough. The surface area of the head of humerus is much more, articular surface of head of humerus. Surface area is much more, 4 times more as compared to the articulating surface area of the glenoid fossa of the scapula. So here, the joint is not congruent. It is not that stable, but range of movement is very good. So, bony configuration is one factor which maintains the stability of the joints. Ligaments which are there supporting the joint either as intracapsular or extracapsular, seen as true ligaments or accessory ligaments. They withstand the stress for a short duration, so ligaments will help in maintaining stability of the joint. Muscles around the joint will also help in maintaining the stability. Example of this is the rotator cuff. Short scapular muscles, tendons of these muscles form a rotator cuff around the shoulder joint. That maintains the stability of the joint. And of course, atmospheric pressure and the force of cohesion also help in maintaining stability of the joint. Thus, in this video, we have done the details of the synovial joints. We studied the characteristic features of the synovial joint. We then went on to study how we classify synovial joints by various methods, and finally we also saw the structures or the factors which maintain the stability of the synovial joint. Thank you.